Hi, my name is George Wanamaker. I'm one of the physical therapists at Presbyterian Village, Austell, and this is a weekly back care and maintenance discussion. What I'd like to talk about this week is a couple of different things: proper sleeping positions, proper ways of doing things around the house, like lifting, bending, twisting, and then just being conscious of your back, making sure that your back is in good alignment, making sure you're not rushing or putting excessive force on your back. So I've borrowed some images from Google, just searching through Google, that I'm going to utilize throughout this discussion to illustrate some of the points I'm trying to drive home. Hopefully you can see my screen here. The first thing I'd like to talk about is proper body mechanics. Body mechanics is essential to think about because your anatomy, your spine, your muscles, and all your organs and soft tissue are designed to work in a particular way. Now they've got some variability as their movements, they can stretch in certain tolerances, but if you're consistently doing activities improperly or adding excessive force, then eventually your body can break down, leading to an injury or chronic pain or other problems. So the first thing is proper body mechanics with lifting. And this picture is essential. So this is a good picture because it illustrates not to bend at the hips and the waist, but to utilize your leg musculature to squat and to pick up something, squatting down and then slowly lifting, allowing your strong lower body musculature to lift the object. We'll talk a little bit about the anatomy of the back here in a second, but essentially this is a key picture to memorize. Don't squat, don't bend at the hips and try to lift, but squat. By squatting, you're allowing your spine to maintain in relatively normal alignment without excessive force one way or another, potentially putting pressure on your nerves, your discs, and other soft structures. This is particularly important if you have arthritis or other low back or mid back conditions where you need to monitor your back's safety. So again, do not bend at the waist. Don't do this. X, squat, lift with your legs. Something to think about. So you might say, well, I'm living at home, but my legs don't feel strong enough. I can't squat at the waist. Well, then you might want to consider some accommodations, like having a raised surface in your house. Like say you're doing laundry and you've constantly got to lift the basket off the floor, get it up to the laundry machine, and a lot of back and forth. What you might want to consider is having the basket on a chair or a raised surface to begin with, so that you're negating the need for up and down, up and down, up and down. You're being more conscious of your back, but also improving the ease of activity and repetitive forces by having the object on a raised surface. Similarly, if you've got, if you're cooking a meal and you need to reach down into a cupboard or a cabinet or something, well, they make certain objects or raised surfaces that you can have your plates or your pans or anything higher up so that you're not having to bend at the waist and potentially injure your back, but you can more easily squat. The nice thing about a lot of the walkers nowadays is they have seats or some attachable platform where you can put your object on the raised surface and bring it with you, so you're not having to bend and lift and bend and lift if you do have weakness or a fall risk. Another thing to consider is having a reacher or a grabber. Reacher and grabbers are pretty cheap. You can find one on Amazon for relatively cheap, or you can have really any drugstore, even Target and Walmart or other big department stores sell reachers and grabbers. So they're readily available and they're cheap, but you might want to consider one so you're not bending a lot, lifting. You have the object close at hand and you can reach with the grabber and pick it up. I'm going to transition now a little bit, if I can find, to talk about the anatomy of the back. And this is a good picture because it shows normal spine alignment. You've got a couple curves. Hopefully you can see my cursor. You've got a normal neck curve. You've got a normal convex trunk curve. In your low back region, right here, you've got a concave curve. And this is the one that we're particularly concerned about when we talk about body mechanics and low back pain and that sort of thing. And you also have a concave down here in your pelvis, a sacral curve, but usually that doesn't play into function. Minimally it does if it's been broken or it's been damaged. But we're talking about this lower back area right here. You can see there's a normal curve. I've chosen this picture from Google for a reason, to illustrate structural changes that can happen over time. Particularly, you'll notice this prominent curve in the trunk region. This is called a kyphotic curve. And also, you can note that the head is more forward than this head, which is an upright normal alignment. What's harder to see is down here in the lower region, the low back, the lumbar region, is this curve that's normally concave. Oop, I didn't mean to do that. Has been flattened out a little bit. And the problem with that is it puts a lot of pressure on nerves that are coming out through the spine here, and especially up here in the top. But also, it's not allowing for adequate space for the spine to move on these little joints on one another. But also what can happen over time is the discs, which hold space in between the vertebra, the bones, can flatten out, leading to structural changes and leading to reduced mobility. So sometimes people will say, well, I just can't reach the floor, so I can't squat, I can't reach the floor, so I have to bend at the hips. That's where you need to be really conscious about making lifestyle adjustments, whether having it on raised surfaces, whether having a grabber or some other means of accommodation to protect your back from further structural changes. Presbyterian Village is great as a transitional, care community with lots of extra help here. There's people readily available, staff who work here, who are able to assist. In the rehab department, often, very, very often, we see patients who have injured themselves from lifting an object that was too heavy, or lifting an object that maybe was bolted to the floor and they didn't realize it and they strained their back, or they were bending down to pick up something that fell on the floor. And when they came up, they pushed too hard, or their musculature pushed too hard on these low back nerve roots coming out. And they ended up injuring themselves, sometimes with long-term consequences. What I'd like to also illustrate in this picture here too, and you can sort of see, I should have chosen a different picture, is your viscera, like your guts, your organs and all that, is contained all within this region, particularly your abdominal musculature. Hopefully you can see my cursor. This abdominal musculature attaches at your low back and your mid back in here. And also you've got muscles in your hips that attach to your pelvis and your back, all in here. When you're doing a lot of excessive bending, lifting, twisting, and straining, you're putting a lot of strain on your low back, which is causing a lot of forces to these small nerves, muscles, and everything within the back and the bones, causing breakdown. In this picture, somebody who's got chronic structural changes and who's kyphotic, where their abdominal musculature is weaker and they can't sustain their upright position as well, your muscles have to produce a lot more force and can't control the movement as well. So you're at higher risk for injuring your back. So again, you really need to consider proper body mechanics, adjustments to lifestyle, and asking for assistance. Let's talk again about the body mechanics now with twisting. I don't have a good picture to illustrate the twisting, but the key point here is to remember that your abdominal musculature attaches to your back. And if you're doing a lot of repetitive twisting movements, these muscles are constantly putting pressure, pulling, and providing forces to the back, causing a lot of strain and compression to the nerves and the tiny bones that are in the back. So something to think about. So when you're twisting, think about stepping instead of twisting at the hips or the trunk, the upper body. And what I mean by that is, so say you're in your kitchen and you have an object on one counter that you want to move to another counter. Now, the easy, quick way to do it would be to just grab it and then twist with your body and put it on the other counter. However, you're at risk for damaging your back by doing this repetitively, or if you already have structural changes, by even just one action of excessive twisting can cause further damage. So what would be the better option is, instead of twisting, stepping. So taking small repetitive steps to get from one surface to another, rather than doing one large rotational movement. Just being conscious during the day is essential. Keeping an open mind, but also keeping your back, being cognizant of your back and making sure you're doing anything you can to protect it, because once tissues and structures are damaged, they often don't heal very well. Another thing to think about is when you're sitting in a chair. And unfortunately, because of COVID-19 and because of sedentary lifestyle and just things that have happened over the course of this past year, there's not a lot of outdoor, well, you can walk and do other stuff around the campus of Presbyterian Village, but there's not a lot of other activities going on. And unfortunately, people have become a lot more sedentary. And this is bad because it puts a lot of strain and compression through our back. And I have a picture here to illustrate that. So this lady in this clip art picture, again borrowed from Google, is sitting upright with shoulders back, head in good midline alignment, and her feet on the floor. What you can also see here is they've drawn in a lower back support. And this is something to keep in mind when you're sitting for a long period of time. Having something that can support the low back, let me go back to the other picture, to support this normal spinal curve so it doesn't flatten out when you sit. So this can be, they sell certain pillows that do the job, but it can be easy as rolling up a towel or using just something relatively soft, but does have some tension to it to keep the shape. The easiest thing we usually recommend in the rehab is just roll up a towel, get some masking tape or something and tape it together so it'll stay put, but you can support your back well. This picture is unfortunately what most of us, myself included, are guilty of. We tend to slump. This can be due to weakness, can be due to changes in our brain's ability to perceive our position in space. But it can also be just, we're comfortable. We're sitting there, we're not paying attention, we're focusing on something else, and we just slump down into this position. Now, this picture I'm going to go back to the picture of the anatomy in a second, but I want you to visualize good upright alignment and flexed posturing. Now keep this visual, and then let's go back to here. Even though this person is standing, essentially you're doing the same thing. Maybe not with the structural changes, although if you have the structural changes, they're going to be worse when you're slumped. But when you're sitting upright in a chair, you've got good normal spinal alignment with the four curves, and your head is in a good upright midline position with shoulders back. When you're sitting in the chair slumped, your head's more forward. It's hard for me to illustrate sitting in front of the camera, but your head's more forward. Your trunk spine is more flexed because we tend to just slump into this position. Gravity is a powerful thing. Gravity takes a hold of us all. And if we're not conscious, if we're not actively using our muscles, gravity will pull us more towards the surface of the earth. And also, let me go back to the image. As you can see, this picture, this person's waist is flexed and the spine has flattened out, the lower spine, this area right here. So even though this person is standing, it still illustrates the same joint mechanics that are happening here. So again, shoulders back, head up, feet in a good position, preferably on the floor. If this, myself included, I'm a short person. Often certain chairs, my feet can't touch the floor. So think about having a step stool or some other accommodation here to maintain good, what we call 90-90 alignment, where imagine this is a 90-degree angle here, and this is a 90-degree angle here. This person it's hard to tell the angles here, but they're not particularly maintaining good alignment. Okay, so the next thing I want to talk about is sleeping. Your mattress can impact your sleep. If your mattress is too soft, it can cause changes with these curves so that these curves can't maintain good alignment. If it's too hard, it can have the opposite effect. And everybody's a little bit different. So you really need to try a certain mattress to see. But this picture in particular illustrates what I'd like to talk about is sleeping on the side. This is borrowed from Google. I just did a Google image search. But as you can see, let's talk about the incorrect sleeping position. So sleeping on the side has a lot of positive effects and benefits. This person, their pillow's too firm or their pillow's too big, causing, normally there's a good straight alignment to the spine up here. But when the pillow's too firm, the spine is flexed in a lateral position. That's called lateral flexion, putting a lot of pressure on nerves and other stuff here on this side, but also it's putting a lot of strain on the shoulder and the neck musculature on the side you're sleeping. I did this to myself the other night. I wasn't conscious of it, and I slept on my left side, but I had my shoulder in a bad position, and it hurt for the next couple days. So being conscious of that. But as you can see, this person, because their mattress is sinking down and because their hips are higher than the spine and gravity naturally goes into this flexed position. Now, a certain way to correct spinal alignment is thinking about sleeping with a pillow between the legs. You have to think about everything being connected, and something farther down the line can affect something farther up the line. And because everything is connected, because there's a bunch of musculature and soft tissue and other things attached all in here that they haven't drawn, having a pillow between the legs helps correct spinal alignment, particularly up here in the lower and mid back region. Another thing to consider is having a pillow that adequately supports the head, doesn't allow the head to drop down, but also doesn't allow excessive lateral flexion of the head. So you really, when you're trying out pillows, think about having enough support to meet the gap between the bed and your face. If it's too fluffy, then you're going to have the problem that this picture illustrates. If it's not supportive enough, then you're going to have the opposite problem. There's some other benefits to sleeping on your side, particularly on your left side. If you think about your body, your stomach is more on the left side of your body, and it's connected to your mouth through your esophagus. And when you're laying on your left side, your stomach is in a dependent position that doesn't allow for, or shouldn't, under normal conditions, allow for reflux of the acids in the stomach and other fluid back up into the mouth and into the esophagus. When you're laying on your right side, gravity takes effect. And particularly if you've got problems with your esophagus or your stomach, all that fluid eventually through the force of gravity is going to flow back into the esophagus, causing heartburn and other problems. So if you have recurrent heartburn when you're sleeping, try to lay on your left side. There's another reason for laying on your left side. Your heart is mostly in the middle of your chest, but it's a little bit offset to the left. And the aorta, which is the big blood vessel that comes out of the heart that supplies to the rest of your body, comes up and then turns to the left. And if you're laying on your left side, your aorta is in a more dependent position, and your heart can more easily pump through gravity and through other forces to your body, versus if you're laying on your right side, then your heart's in the dependent position and your aorta is raised. So your heart's got to work a little bit harder to overcome the force of gravity to get to the rest of your body. So to summarize, laying on your left side has a lot of benefits. Having a pillow between your legs to help maintain better spine alignment, and having a pillow that adequately supports your head but doesn't provide too much support, so you're putting strain on your neck muscles, but you're also putting pressure to sensitive blood vessels, nerves, and other structures in your spine. Okay, let's talk about walking position. Shoot, I didn't get a slide for walking, but we can use this slide to illustrate. So one of the things I really want to talk about, particularly at Presbyterian Village, there are a lot of people who use walkers to get around, whether it's a standard walker that has the metal post, 2 wheels in the front, or it's the rollator, the 4-wheeled type walker that has the seat and the brakes and all that. As you age and structural changes take place and muscle weakness sets in, it becomes a lot harder to maintain good upright posture. And what we commonly see is people, they still want to maintain their pace, their pace for completing activities and walking. But unfortunately, because of structural changes, because of weakness, or because of other issues, they end up keeping the walker too far out in front of them. This has a bunch of different consequences. Particularly, you're at risk for a fall, and what you're doing is you're just making worse and exacerbating this structural change, this flattening of the curve in the low back. So what we commonly see is people will say, when I stand up, I can't stand for a long period of time, and I can't walk for a long period of time because I have pain. Well, there's a couple of different potential remedies for this problem. One of them is slow down your pace. If you're walking too quickly and the walker is too far out in front of you, your posture is going to be a lot more flexed, and in order to keep up with the demand of your body, you're putting a lot of strain on your muscles, particularly your core muscles, to maintain your position upright, but also you're putting a lot of strain to your back, the structural position, the bones, the discs, and the nerves coming out of your back. So think about slowing down your pace. Yes, it takes longer, but in the long run, you're doing less damage to your body. Another thing to think about is keeping shoulders back and head up. What we see a lot is people walking, and a lot of times when we're doing training on walking, people will be looking to the floor. And I'll say to them, okay, look up, stand up straight, keep your shoulders back. And they'll say to me, well, I need to look where I'm going. Yes, you need to look where you're going. However, if you're more flexed in this position, and particularly if you're looking at the floor, you're a lot more at risk for low back pain and changes to your back. You're also more at risk for a fall if you're looking down towards the floor, towards your feet, versus looking forward, because gravity is constantly acting on you. And when you're more flexed looking at the floor, the effect of gravity is intensified, causing you to lean more forward and potentially fall. So it's actually better to look up at where you're traveling versus looking at the floor. I keep coming back to gravity. Gravity is a very, very powerful force. And in order to maintain good body mechanics, spine health, you have to think about the force of gravity. You have to be more cognizant during the daily activities of what gravity can potentially do to your back, as well as to your fall risk. So we talked about the anatomy. We talked about sleeping positions. We talked about sitting positions. Be conscious of not slumping down, but sitting in upright alignment and potentially having a towel or something back. And we also talked about bending at the knees and the hips to squat to lift up something, or making accommodations, not bending at the waist here. What I'd like to finish up with is think about mobility during the day. And I've said this in a couple of my other lectures, but think about maybe setting a timer to get up, stand, stretch, even just standing up. If you set yourself a timer or have scheduled times during the day to stand up, you're allowing yourself to, where are we at? Get out of this position and straighten all the curves, normalize all the curves in your back. A lot of people nowadays have cell phones that have timers. You can set a timer for every hour or have a kitchen timer or something to that effect. Just be more conscious. Presbyterian Village, I'm at the Austell campus, and there's lots of resources here for mobility. There's a path that goes around the whole campus, which people frequently do during the day. Because of COVID-19, the Wellness Center was closed, but now it's in the process of opening again. And there's other activities and resources that are beginning to occur to allow yourself to be more accountable for mobility. And then stretching, particularly not being in this position for a long period of time. Allow yourself to stretch your shoulders, stretch your neck, stretch your back. Allow your body to naturally, periodically go through its normal positions to improve its alignment, but allow for reduced pressure to these areas in the back, and allow for your body to orient itself more towards the upright position, not only to strengthen your muscles, but also allow for the nerves, the blood vessels, and everything in the back to have adequate space to work properly. Also, if you're stretching and you're more upright, you're allowing your heart, your guts, your intestines, everything to work as they are intended more efficiently, versus when you're in a flex position, you're essentially blocking everything from working properly. So I think this will conclude this lecture. Again, my name is George Wanamaker. This is a back care and maintenance lecture, and I hope you've enjoyed it. Thank you.